My name is Magdalena Evans. I am 24 years old. I'm a Tanzanian. I am a civil engineer by profession. We came to India, Bengaluru, at Apollo Hospitals 2 weeks ago. And the main issue was treatment for my grandmother. She's called Blandina Kabadi Butambala. She's 88 years old. She was suffering from aneurysm. We got a medical invitation to Apollo Hospitals under Dr. Sunder Narasimhan, Vascular Surgery category. He took care of my grandmother.
This patient, Mrs. Butalamba Blandino Kabadi, she was airlifted from Tanzania because of acute abdominal pain, and where in Tanzania they did an ultrasound scan and they found an aneurysm. So they were suspecting that the aneurysm could have ruptured. So she was airlifted and she was brought to our hospital. When she was brought to our hospital, she was pretty stable. She was not in shock, so we immediately subjected her for a CT scan. And the CT scan showed a very large juxtarenal abdominal aortic aneurysm, which is nearly 11 centimeters. The rupture risk for the aneurysm, when it is beyond 6 centimeters, is about 20 to 30%. For 11 centimeters in literature, we don't have any rupture risk. I would probably say that the rupture risk is more than 90%. So not only that, 88 years old, and she's got comorbid features like coronary artery disease, and of course also she has got some interstitial lung disease. So considering all this, when you are looking at doing an open operation, it is fraught with lots of complications, and patient may not survive the operation because we have to make a big cut in the belly and do this. So we thought of doing a very innovative procedure which is called endovascular aneurysm stent graft repair. But even for that, the morphology, the anatomy of the aneurysm was so complex. It was very tortuous and dilated, and lot of curvatures in the aneurysms. But we were able to actually repair this aneurysm with the help of a small cuts in the groin, and through that we were able to take the stent graft and deploy the stent graft and seal the aneurysm, and finally she recovered very well, and then she just started walking the second day following the procedure, and we could complete this procedure over 3 to 4 hours, and then she was given a very mild and gentle anesthesia. So thereby we avoided all the complications, and then she recovered very beautifully, and she was discharged 4th day following the procedure. And we had to do some special techniques in order to get the top end of this one aneurysm sealed, because she was having a 33 millimeters neck, and so the available graft is not that very big, so we have to use some special technique like reverse sliding technique and all that. So we did that, and then we completely sealed the aneurysm, and we got good results. And this is the beauty of this procedure. So if you plan and execute your decisions and actions properly, then it is not surprising that you are looking at a best outcome, and that's what we achieved in this patient. And even the patient is happy, and patient relatives are happy without any complications. So future course of action would be just to do a repeat CT scan after 1 year, and that's it, we'll take a call. And this is what I would recommend for all the patients who have an abdominal aortic aneurysm, especially those who are elderly, who are not fit for operation.
Whereby on Monday, surgery was done. They used the stent grafting method to recover her from the aneurysm problem. She's now doing fine. We thank God. Probably today you're going to get discharged from the ward. She's doing well. She's living normal. She can walk right now. We're all happy for her treatment. We thank you so much, Dr. Sunder Narasimhan, specifically from the Vascular Surgery category department, and other doctors, nurses, and everybody. Thank you for your cooperation. We are so grateful to be here at Apollo Hospitals. Namaste.